This patient has an interesting problem. She has varicosities involving her posterior thigh and popliteal crease down into the calf without any obvious feeding, treatable, insufficient vein above that point. And the options on her are either injection sclerotherapy. I think, as you can see from the superficial nature of her veins, though, I think that any sort of injection sclerotherapy is going to cause more of a permanent discoloration since her skin is so translucent. So when she does stand, these veins are varicose. They're not just reticular veins. After a fair amount of deliberation, decided to proceed with microphlebectomy. And this will truly be a microphlebectomy in that these veins are very small. But I think with gentle technique and a significant amount of tumescent anesthesia, we should be able to remove most of these veins and give her a more optimal result than with injections alone. So what I'm doing now is just injecting some xylocaine in both legs just to get them nice and anesthetized. And one probably, if somebody was going to inject these, they'd probably, the choice would be a foam sclerosant. Only FDA-approved sclerosant that we have aside is sodium tetradecyl sulfate, and that's only approved to be used in the liquid form, although many physicians will use that in combination with some air. There's been a lot of discussion about the safety of performing foam injection sclerotherapy. There's been documentation of air bubbles passing through the heart. And specifically, that's a concern with, in patients with a patent foramen ovale, with the possibility of those bubbles crossing from one side to the other and then into the arterial circulation, possibly causing some sort of cerebrovascular incident. And that's not just a theoretical concern. I think it's a practical concern as well. So I think that although foam sclerotherapy has been performed by many surgeons or phlebologists on many different patients, I think there's a couple of precautions that you need to take when considering using that. First, you need to, I think, inform the patient that this is an off-label use of the sclerosant, that is, combined with something other than just itself or saline.